See Local 2. This is Beyond the Headlines.
Good morning, I'm Kim Davis. Welcome to Beyond the Headlines. Thank you so much for joining us. While the Texas budget shortfall continues to impact services across the state and now even the Harris County Jail, the Texas Senate Finance Committee has proposed severe reductions in state funding for community-based health care programs. Experts say these cuts will ultimately create more of a strain on law enforcement and higher bills for taxpayers. Here are some of the interesting stats on mental health funding for the Harris County Jail. The Harris County Sheriff's Office spends at least $27 million a year on mental health care for inmates. On any given day, there are 2,400 inmates taking prescriptions, psychotropic medications. That's approximately 1/4 of the total jail population, which makes the Harris County Jail the largest mental health institution in the state. Wow. Adrian Garcia is the sheriff for Harris County, and Dr. Michael Seale is the Harris County Jail's executive health director for health services. Good morning, and thank you for being here. So we've been hearing, obviously for months the state has some budget problems to fix, and we keep hearing about areas where they're thinking about cutting. And this one, is important to talk about because when you talk about mental health and what needs to be done to care for those inmates, it really can affect people inside and outside the jail.
That's correct. It's a community problem.
And so what is the thing that you want to make sure people know most about why these kind of cuts can affect them at home?
Well, first of all, there's a consensus in the community that the county jail should not be the place where people can get the best type of mental health services. They should not be allowed to deteriorate to that point. They should have access proactively out in the community. Their families should be able to have some degree of expectation of getting their loved one into particular services, but not let them deteriorate to the point that they cause a problem or a danger to themselves or another that results in law enforcement having to take some particular action that puts them into the county jail, and then it becomes our collective challenge to address. And so it's a community problem, not just law enforcement, but inadvertently what will happen is that more of these issues will start to occur, more families will be under stress, our officers will have to take more actions. Forget the incarceration. I'm concerned about tasings. I'm concerned about physical confrontations out in the community. I'm concerned about the ultimate circumstances that could occur between a law enforcement officer and someone who is under a mental health crisis.
So the mental health crisis we've been hearing about, and you know that it affects people, and like you said, when you look at those numbers, when 1/4 of the population is on some kind of mental health prescription, it makes this the largest institution in the state for mental health. That has to be kind of concerning, Dr. Seale.
It is, and we're reluctantly the largest mental health organization in the state. We screen everyone who comes into the jail for mental health issues, and the sheriff obviously can't control who comes into the jail. It's our responsibility, our charge, to take care of detainees when they come into the jail for medical and or mental health issues.
But aren't there also, you're also bound by some constitutional rights in terms of what you have to do. People might say, well, you don't have to treat, you have to treat people if they don't pass a
correct. Detainees have a constitutional right to health care.
So this is something that obviously needs to happen even before they get to the jail. But once they're there, what you can't afford, I imagine, is to have cuts in the prescriptions and the things it takes to treat these detainees.
Yeah.
That's right. And the other side of it is that Dr. Seale and his staff do an incredible job of stabilizing these folks when we have them in our custody. And they go back out into the community. It is regretful that the good work that we do to stabilize those individuals, and then when they are released back out in the community, they're not going to have access to anything. They're not going to have any other support. As a result, they're going to deteriorate again, and they're going to come right back into our custody. It's going to become a huge revolving door funded by the taxpayers.
And I think that's one of the keys when you talked about, when I read the information, we all are trying to figure out where do we cut, where do we make some cuts and try to get this budget back on track. But this will ultimately cost taxpayers more money.
Well, absolutely. Our hope would be is when we discharge someone from the jail, and the sheriff releases somewhere around 350 people a day. So if 25% of the 350 are taking psychotropic medication, not all need follow-up. Some have private physicians and family members can manage their medication. But for those that do, we're discharging something like 85 people a day, 7 days a week, 365 days a year, that need follow-up in the community. And as the sheriff said, if there's not a pickup, If they can't access medication, they can't access services. Many are homeless and they need housing. If we can't accomplish those goals, it's hard to achieve stability, and you see the revolving door where they cycle back into the criminal justice system.
Which obviously is, creates goes to a lot of the other problems you have with overcrowding and issues that may be managed if this problem is under control.
That's correct. I mean, once again, the county jail should not be the place that we house folks that we're worried about. We should be housing people that we're afraid of. And so the county jail shouldn't be the place where folks that have no control for why they have developed a mental health condition shouldn't be the place where they get help. It should be out in the community.
We'll take a short break. We're going to come back and talk a little bit more about what you should know and what you should be telling your legislators. We'll be right back.